Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan for our weekly update on COVID-19. There's been some news since we last spoke to you regarding Pfizer and the FDA application going to be made. These type of things, as you know, it's almost on a weekly basis as new data comes out. We're here to report, and Dr. Bogan and her team have stayed on top of this. I'm sure there'll be questions regarding boosters, and that's been in the news as well lately. We'll continue to do that. But the one thing that has not changed, the one constant that has been there, is that vaccines work. And Dr. Bogan will talk about that in some of the testing and some of the results regarding hospitalizations, fatalities, et cetera, regarding vaccinations. But the two things we really know work, vaccines and masks. And those are the things that we want to continue to keep people safe and continue to do things. I'm also, as I've been talking to a lot of organizations, a lot of companies this week, we really have an awful lot of companies that are over 90% of their employees vaccinated. And we're very, very proud of that. So great kudos to those community groups out there and those businesses that are continuing to push that. That's a way to get safe. That's a way to get out of this pandemic. And we'll continue to work to make sure that that happens. So now let me bring up Dr. Bogan to give her weekly report on the pandemic.
Thank you, County Executive. Good afternoon. Welcome back to our regular COVID briefings. Unfortunately, cases continue to increase here. We are now averaging around 400 cases a day, while hospitalizations and deaths have modestly increased. I wanted to spend some time today talking about breakthrough cases. As I said last week, with the Delta variant, we have seen more breakthrough cases of COVID-19. But I want to make it clear that the percent of breakthrough cases is not a reflection of how well the vaccines work. As the percentage of the population that is vaccinated goes up, the percentage of cases among the vaccinated also goes up. In an extreme example, if almost everyone is vaccinated, the percentage of breakthrough cases will be very high, but the risk to the vaccinated is still much lower than the risk to the unvaccinated. I want to walk you through some local data to demonstrate this point. When we examine our Allegheny County data from June through now, that's focusing on the time in which Delta variant has predominated in our cases, there were about 2,600 cases among the roughly 700,000 fully vaccinated residents, which means that the risk of infection was about 0.4% among the vaccinated. Compare that to the unvaccinated. There were about 12,500 cases among the roughly 500,000 unvaccinated residents, for a risk of 2.5% of infection among the unvaccinated. Using these data, the unvaccinated are about 7 to 8 times more likely to have a case of COVID than the vaccinated, even in the era of Delta. Similarly, here in Allegheny County since June, you were about 10 times more likely to get hospitalized with COVID if you were not vaccinated. And for deaths in Allegheny County since June, you were about 20 times more likely to die of COVID if you were not vaccinated. So to be clear, the vaccines are doing their job. They're very effective. They help protect you from serious illness, hospitalization, and death. So please, I encourage you all to get vaccinated. If you need help, please call 211 for assistance with finding a vaccine. Moving on to masks, which is also a topic I discuss regularly at these briefings. Over the weekend, for the first time since the pandemic began, the Steelers played at home before a full crowd, which included fans from across the country. And unfortunately, it was brought to my attention by people who attended the game that many were not wearing masks. The Steelers had announced a policy that fans should wear masks indoors and in the concourse, but people who were there described to me a packed stadium with people shoulder to shoulder for extended periods and few of them wearing masks. They're concerned that the event could lead to further spread of the virus. While it's too soon to tell if those fears will come true, I must remind everyone that masks are one of the most important tools we have in limiting the virus's spread. I continue to fully and strongly support CDC's recommendations for masking. which means wearing masks indoors, but also outdoors in crowds, and especially when you can't physically distance, like at a sold-out sporting event. I am thrilled that we are starting to get back to doing the things we love, like going to Steelers games, but I urge everyone to consider their surroundings. We are still in a pandemic, facing a variant that is highly transmissible. So please make decisions that protect you, your loved ones, and your community. That goes for educational settings too. Parents and teachers, please ensure that children are wearing their masks properly and keeping them on. The best masks features a tight knit material to help prevent respiratory droplets from passing through the mask. An open weave doesn't fulfill the function of trapping large respiratory droplets from talking, coughing, sneezing that could contain the coronavirus. We are regularly seeing 50 to 100 cases a day in children under 12 who are not yet eligible for the vaccine. I want every child and educator to stay safe as schools continue in-person learning. And the best protection for them remains the proper use of masks. I also ask people who test positive to answer calls from our case investigators. In order to reach more people during the latest surge, we are now using the Pennsylvania Department of Health's Connect and Protect form, which is a secure, confidential digital case investigation tool, similar to the one that the Health Department used during surges last fall. Residents between the ages of 19 and 64 who are contacted by an ACHD case investigator will be asked to use the form, and if they agree, they will be sent a link via email, and we hope soon via text. The form is available in multiple languages. Using this form allows the Health Department case investigators to reach more people in an efficient time frame. And the information provided helps us better understand how the disease is spreading in our community, and it helps us to limit the further transmission of the virus. Meanwhile, we keep close eye on the data. We continue to monitor developments about booster shots and vaccines for children under 12. The Health Department and our region's vaccine providers will be at the ready to administer vaccines when we are given the ready to do that. By now, we all know that getting through a pandemic is incredibly difficult. And as I said earlier, the surge continues, and I don't believe we've quite reached our peak. So I ask that we all do what we can to protect each other, including getting vaccinated, wearing masks, and showing care and concern for the people around you. I always end these briefings by saying be safe and be kind, which is advice worth following during this ongoing pandemic. And so, as always, please be safe and be kind.
This first question that we have is from Public Source. As a pediatric specialist, does Dr. Bogan have any guidance for parents of children without COVID-19 who need emergency or urgent care?
We've talked about this in the past, in that going to healthcare is very safe. And so I encourage people to continue to seek healthcare as necessary, including their preventive visits and their well visits. But I also remind people that there is a difference in how you should be using primary care, urgent care, and emergency care for the level of need that you have. So yes, please go get your health care. It's available and it's safe.
The next question is from the Pittsburgh Business Times. The last few reports, including today's 298 cases, are lower than they have been. What is your thinking about what this might mean? Is this a blip in the report, or does it represent a slowing down of cases or a plateau?
I encourage you to look at our county dashboard with our ongoing data that we update daily. And that can again be found at alleghenycounty.us/coronavirus. You'll see, if you look at the graphs that are up there right now, that our cases are continuing to increase, that number 298, again, you want to look over a longer period of time than one day. We tend to look at a week at a time, and we're now having about 400 cases a day over the last 7 days. So, and as I said in my remarks, I don't think we're quite at our peak yet, and I try really hard not to make major predictions. I use the data and follow the data.
WESA notes that data from the Pennsylvania Department of Health shows that hospitalizations, both locally and statewide, are the same level as what was seen in mid-November of last year. How concerned are you that our medical systems might eventually have to operate under crisis standards of care when hospital staff must decide which patients to prioritize due to scarce resources?
So definitely, as you note, the hospitals are full, but they're not full like in the winter. They were full with COVID cases. Right now, they're full with not nearly as many COVID cases as were in the last fall. They're really full of the typical medical conditions that exist across our concerns in our community. So the total number of COVID cases in the hospital is significantly less than it was last winter. The vaccines are to be thanked for the lower cases of COVID in our hospitals. Our hospitals all have surge plans. They have ways to make adjustments on where beds are, and they also can do things like postpone non-urgent surgeries and others. And as I said last week, first of all, I don't oversee healthcare, but our hospitals really do have contingency plans, and I encourage you to talk to them about them. And I trust them to have this well in hand.
This next question is from KDKA Television. Where are the majority of new pediatric COVID-19 cases being traced back to, school or somewhere else? And how many school outbreaks of COVID-19 are on the county's radar? And are the cases primarily among students or staff?
So thanks for that question. So we're aware of about almost 1,600 cases among children age 5 to 18 so far in September. Some cases are from school, some are from extracurricular activities, including sports and other activities. Others report traveling and attending parties during their incubation period. So it's really from many different sources, not just one, not just school. We also have at least 45 cases who identify as teachers in the month of September. And again, they also give a variety of locations of where they potentially were exposed: school, parties, bars, traveling, other activities. So not one particular place. Our current outbreak status is that among K-12, we have 5 open outbreaks and 6 open clusters. And outbreaks and clusters remain open for 2 incubation periods, so 28 days in case additional cases need to be added. So they remain open for a long time, is what I'm saying. So those 5 outbreaks and 6 clusters remain in place for a long time, don't close quickly.
This next question is from WESA. Is the David L. Lawrence Convention Center still a designated site for a field hospital? And do you think a field hospital might be needed in the coming months? How would a field hospital at the convention center be used, and which patients would be sent there?
So I'm just going to answer really the first part of that question, which is we are nowhere near needing a field hospital in our community at this time.
Public source noted that the state announced yesterday that it is prepared to start giving booster shots pending approval. What preparations have been made so far by the county, with boosters likely to begin for some populations?
So the booster vaccine, just to be clear, are the exact same vaccines we've already been giving. And all of the vaccine providers in the county, of which there are many, pharmacies, doctors' offices, healthcare organizations, and others who are ready and able to give the vaccine. So again, we meet as a group and talk about vaccine distribution and vaccine needs in the county. And we're all sort of gearing up and we'll be ready when we're given the signal to do so.
KDKA Television says that districts have been mapping out guidelines for how many active COVID-19 cases among students and staff would cause school closures. Obviously, you touched on this briefly. Does the county provide any universal guidance on this, and what would Dr. Bogan suggest regarding that?
So the schools follow the guidance of the Pennsylvania Department of Education and the Pennsylvania Department of Health. And what we do at the health department locally is really help support people to follow those guidance and help schools do that. But we do not give specific recommendations on school closures. We really are just there to support them. The guidance comes from the state.
And that was the last question. I apologize for no advance warning on that, but that was the final question. If there are any closing remarks.
Thank you very much.
Thank you, Dr. Bogan, again for the information that's been so helpful. and to allay some of the fears around rising cases and hospitalizations. I think putting it in perspective among, again, the vaccinated people who've been vaccinated just have lower incidence of getting it to begin with, number 2, getting hospitalized, and number 3, passing away from it. So we know they work, and that's the good news. And as further information comes out regarding the under 11, the under 12 population, approvals that hopefully be coming in the coming weeks, the plans of vaccinating that age group, as well as any booster information, as Dr. Bogan talked about, is really important, and we'll continue to keep you updated on that. And the plans are, they're being worked on. And as Dr. Bogan said, there are so many partners out there among our healthcare facilities, our pharmacies, doctors' offices, et cetera, that we feel very confident we'll be ready to supply the needs of the community as we have throughout. So we will, again, be with you again next week, and stay tuned. Thank you.
Our next regularly scheduled briefing is Wednesday, September 29th at 4 p.m. Thank you for joining us.